Hi everyone, for my senior thesis presentation, I decided to focus on Lyme disease. And I posed the question, why Lyme disease has become a public health concern. Lyme comes from the bacteria Borrelia burgdorferi. In the late 70s, Willy Burgdorfer discovered a connection between a deer tick bite and several illnesses contracted by adults and children during that time. It led to research which later discovered that the deer tick bite led to Lyme disease and severe chronic illnesses. Today, many doctors believe, though, that the deer tick bite is not the only way that Lyme can be transmitted. It can be transmitted through placenta, intercourse, and even through blood. Lyme disease is detrimental to many families throughout the nation. Yearly, the CDC records 300,000 cases a year, and those are the cases that have been confirmed and diagnosed. However, there are thousands of others who are left undiagnosed or mistreated because doctors are not able to know what they have. I know this based off experience, and that is one of the fundamental motivations for this presentation. I myself have Lyme disease, and it has definitely affected my life in various aspects. However, I'm not the worst case. I'm not affected by this the most in my own life. My mother, who also has Lyme disease, was diagnosed about 5 years ago, and she has had it since she was 5 years old. She's had this illness for 30 years and went undiagnosed for 25 of those years. Unfortunately, this is not a new story, and it is not something new to the Lyme community. This is known as chronic Lyme disease that has developed through years and years of treatments and surgeries that did nothing to treat Lyme but rather suppressed the other symptoms. Furthermore, this is important because as we continue to progress in science and within the medical field, it is important to focus on illnesses like Lyme disease because they can change over time, and the more we progress within our studies, the better we can combat this illness. Lyme disease has progressed throughout the years since the 70s when it was first discovered up until now. Many doctors don't believe that Lyme disease can become chronic or that it is an actual disease. This is an unfortunate story for a lot of patients like my family. Lyme disease affects the body internally and has so many medical and internal impacts as well as social and economic impacts for all those who are suffered by it. It impacts more than just the individual self, but the family and the community around them. Furthermore, it is important that we as a community build our knowledge on this subject so that one day we can come to the point of where no one has to go undiagnosed or become a chronic Lyme patient. Now you might be wondering, why aren't doctors and scientists putting more time and research into this? If it is such a big issue within the nation and for individuals, why aren't we investing more money and research into something that is hurting so many lives? Well, it's because a lot of doctors don't actually believe this illness exists. Although the CDC recognizes that Lyme disease has surpassed West Nile virus, some forms of cancer, and HIV in cases, many doctors aren't able to track it on their tests and scans, so they believe it to be more psychological than a physical illness. This leads to so many patients becoming chronic and getting mistreated and undiagnosed for years and years, similar to that of my mom. But it is, in fact, a real illness that affects so many lives in so many aspects. And because of the medical complications, it affects Lyme patients economically, physically, and socially. In this presentation, I will be focusing on the physical complications and medical aspects of Lyme disease and how they affect primary and secondary cases. In addition, I will also address the economic aspects and how a person's financial status can affect their treatment and how much treatment they actually receive. I will also talk about the controversy surrounding Lyme disease and how there is a lack of support for patients from families, doctors, and the community as a whole. I hope to draw your attention to the concern that many individuals who have Lyme and Lyme literate doctors have about the growing problem of Lyme disease. I hope to influence and promote this message of how we can fix this public health concern and just why it needs to be fixed. So what is Lyme disease and how exactly does it affect our bodies? If I told you everything, I would be sitting here for quite some time explaining to you all the details and everything. But it is important to establish that Lyme disease has major detrimental impacts on anyone who has it. It's the most common vector-borne disease in the United States. So Lyme disease isn't focused on a lot within our nation and within the medical field, but it is a huge problem that continues to progress. A lot of doctors don't see how this disease is actually real. Well, why is that? It's because it evades many tests. The only test it doesn't evade is the blood test known as the ELISA test. Essentially, it tracks the amount of antibodies in the body and determines that certain chemicals and different things are actually Lyme disease. However, no test known in the United States or anywhere else can actually detect the bacteria inside the body. But here's why. Lyme disease, when it enters the system, the bacteria, the Borrelia B bacteria, hides behind healthy cells within the human body. And once it is injected into the system, it causes the body to release neurotoxins. Essentially, the bacteria is causing our bodies and anyone who's affected by it to release the neurotoxin and attack ourselves. So it's actually our bodies attacking us, and that's why no test can detect it. This has caused a lot of problems for doctors and patients because if a doctor isn't able to see the bacteria, then how do we know it exists? How do we know it's in the body? There are physical detriments that are happening to an individual, but still not going unaware in any medical or scientific aspect, which is what leads a lot of people to believe that it doesn't exist. But through the ELISA blood spot test, this helps doctors to understand that there is something actually chemically happening to the body. It's just we aren't able to see everything. However, there has been cases known that the blood test does not detect. The blood test, a study done shows that the blood test actually causes patients to go 50% to 70% undiagnosed. And it's the most reliable test we have. This is unfortunate because if we already are struggling to create a test that works, then a test that only works maybe 50% of the time, it causes a lot of complications. Now, because of the neurotoxins that are released inside our bodies, this causes an assortment of other problems and co-infections, such as fibromyalgia, gastrointestinal issues, muscular issues. It affects every system in the body that we have. But the crazy part is, not everyone's affected in the same way. Some patients may only be affected through gastrointestinal or serological ways. The problem is, if everyone is affected differently, then how are doctors supposed to maintain a clear treatment path for every individual who has Lyme disease? Now on to treatment. So, as I have said before, treatment can vary between every patient because every patient has different symptoms. Typically for early stage Lyme patients, they will receive antibiotics for around 6 to 8 weeks. This can work, and it has worked, but for cases that don't, it often leads to chronic issues and further problems. And if you are a chronic patient or have gestational Lyme, then antibiotics do not work, and you will have to resort to other forms of treatment. So there are a lot of treatment ways that are being developed. So one example of that, there are two intense treatments that are used. The one most commonly used at many Mayo clinics and the Invita clinic in Arizona is the series of different treatments combined into one session. So typically patients will receive a port in their chest. Essentially, as shown in this image, the port is a device that is put into the chest and it is linked to the aorta. And it allows patients to quickly be accessed for any blood transfusions or liquids and medications that need to be pumped through the body. They do this because putting it in the arm every day would cause bruising and a lot of scarring. So Invita Medical Center uses the port as well as different antibiotics combined with sauna treatments and other sources to help combat the Lyme disease. They try to draw the toxins out and suppress them so that the more you attack it with aided help, the less the toxins will be produced inside the body. This has shown a lot of successful results. $100,000 for a single patient, and that doesn't necessarily entirely include living, because you have to address later. But there's also a new form of treatment that has recently come out, hypothermic treatment. Essentially, it is a treatment that was shown to actually kill cancer, but little did scientists know until recently, it actually combats Lyme disease. What it does is you're put into an incubator and it heats your body up to very high and even dangerous temperatures in order to kill the bacteria and the toxins that are being produced in your body. It releases the toxins similar to that of the in vitro treatment. Thankfully, this treatment is much, much cheaper. However, it is only in. Aside from the physical aspects of Lyme disease, Lyme patients face financial issues and social stigmatization daily. The typical test for Lyme disease costs around $200, and that's not even factoring in the doctor's visit and the doctor's visit afterwards to know your results. The bills continue to add up, especially for those who have chronic Lyme disease, who had gone to see a doctor for years and years and paid multiple medical bills for medications and surgeries and visits. The bill gets even higher for chronic patients. Once a patient tests positive, there's a long medical bill awaiting them. A study done by Lyme Policy revealed that patients are paying up to $10.1 billion as a whole in the United States for early stage Lyme disease, and the cost only increases when it comes to chronic Lyme. The study showed that as time went on, the cost for patients increases. The group of patients within chronic Lyme disease years pay up to $75 billion for treatment. Now, calculating, that's around $250,000 per patient. A huge amount of money. It's the cost of a house in most places. Now, the problem with this is it's coming out of patients' pockets. Insurance companies do not pay for any form of treatment. Therefore, patients are having to be financially strained in order to receive treatment and become healthy. But unfortunately, not many families are able to pay for that. There are organizations and various nonprofits that have contributed to the Lyme community, and they have been a tremendous help to many, many families. Unfortunately, that is not even half the cost of treatment. While they are helpful, it doesn't cover everything. So this should honestly push the government and different scientists to push for more research so patients aren't having to pay for out of pocket and shouldn't have to pay for chronic Lyme treatment. Instead, if it's caught early, then patients lower their medical bills significantly. Now, because patients are having to pay out of pocket and often they're getting misdiagnosed, this does benefit many pharmaceutical companies, and that is one of the main economic drives for people like Lyme patients not to be aided. Pharmaceutical companies make tons of money on the pre-diagnosis and even post-diagnosis and misdiagnosis of patients. But if patients are aided and insurance companies start covering and funding better research for Lyme disease, pharmaceutical companies won't receive as much money as they did before. Now, what's causing patients not to be covered? Why aren't insurance companies helping Lyme disease patients? This is the result of the guidelines by the IDSA, or the Infectious Disease Society of America. The IDSA is one of two groups that regulate and create guidelines for chronic illnesses. The other one is an IDSA, though, is established here in the United States and offers guidelines that control and restrict physicians as well as the CDC from certain information, treatment, and diagnosis. Because of this, physicians are restricted from treating chronic Lyme disease and offering aid. Now, the IDSA claims that Lyme disease is fairly simple to treat and the only treatment is antibiotics. However, that leaves a huge portion of Lyme patients that are chronic or congenital out of the mix. Because of this, the IDSA creates guidelines that restricts many physicians from helping their patients and often says that chronic Lyme disease doesn't exist, and any patient claiming to have chronic Lyme or persistent symptoms after antibiotic treatment are hypochondriacs. Doctors are referred or told to give their patients psychological care if they has persisting symptoms. Because of the disconnect between the IDSA guidelines and chronic patient symptoms and stories, this led the Connecticut Attorney General to do an investigation of the IDSA chairman, discovering that he handpicked the board that creates the regulations and has financial interest in many pharmaceutical companies. Unfortunately, the people who are controlling how Lyme patients are treated, diagnosed, and aided, and also insured, is controlled by someone who has high interest in pharmaceutical companies. And because of this, that is why most patients are given antibiotic treatment and nothing else. No further help is provided, and they are left helpless with a financial burden that isn't easy to overcome. To this day, the IDSA continues to ignore the growing crisis of Lyme disease. As shown in this chart here, the cases of Lyme disease has increased significantly, but because the CDC is regulated by the IDSA, they aren't allowed to record chronic Lyme, and the amount of cases that go undiagnosed are significantly higher, as shown in this graph, than the actual cases that are diagnosed and reported. Communities are often put down for advocating for Lyme patients because no scientist or physician is supporting them or backing them up. This lack of support from doctors, even family, friends, and insurance companies leaves a lot of patients hopeless. In a study done by McSweden, it was found out that the leading cause of death within Lyme communities is suicide. They're left financially burdened with little to no. The economic and social impacts of Lyme disease is very weighing on any individual. It strains many relationships and can lead to a lot of health problems within individuals. It's not just a health concern though, it's a mental and economic concern. In order to change this, the public and physicians and scientists need to put more effort into researching this and needs to inform the public more about the causes and treatments and issues within Lyme disease. If not addressed, then the problem will continue to get worse, patients will become sicker, and the financial burden will only increase. However, once scientists and physicians and the community and different organizations like the IDSA change their guidelines and reform them to what is currently happening, this can improve the situation significantly. Lyme disease is a public health concern and has only gotten worse. I have addressed the physical aspects of it and how it is detrimental to the body, and I've described the controversy surrounding it, as well as the economic and social impacts of it. Beginning my research, I knew that Lyme disease was a problem, but I never understood how it progressed within the United States and became a public health concern. Looking at it from an outside perspective, I gained an understanding of just how much this illness has impacted so many people and how big of a problem it has become. Based off personal experience and comments from loved ones and other individuals I've spoken to, it's frustrating for every patient who has gone through this. It's frustrating to know that no one truly understands what is happening. The public isn't informed and no one is helping. Doctors are putting you to the side and giving you psychological treatments rather than physical and helpful treatments. Insurance companies are leaving you to yourself to pay for your own treatments, and it's some of the most difficult decisions are made. Thank you guys for watching my video. I hope that this presentation was informative and helped you to gain a better understanding of what Lyme disease is and how big of a problem it has become.